We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
We are ready.
We too as well.
Look up to the rainbow where the colors become one. Red, yellow, orange, green is for good health and the care we need. Blue, violet, indigo is for happiness and peace to all. Look up to the rainbow where the colors become one. Look up to
Rainbow Children's Hospital and Birthright by Rainbow Hospitals.
Good morning, everyone. I'm Dr. Rohit, and would like to invite you and welcome you to this webinar by Rainbow Children's Hospital. It's been, a year and a half of pandemic that we all have been facing. Children have been indoors. Lot of missing in school. So what we wanted to do was maybe just have a couple of our doctors discussing the precautions and what all we should do as the schools are opening. It's very heartening to see that we have a lot of parents, teachers, even children who have joined this webinar. So I hope we can answer all your questions. Please feel free to put your questions, make it interactive for the next 45 minutes to an hour. We'll try to answer all your questions to make sure that whenever the schools open, whether it is on first or after that, we just make it safe for everyone. So I would like to introduce our panel to you. All three are very, very eminent pediatricians in the city of Hyderabad. So first of all, we have Dr. Faisal. Dr. Faisal is the lead pediatrician in our Banjara Hills unit. He's a very, very busy pediatrician in this part of the city. Thank you so much for joining us, Dr. Faisal.
Thank you, Dr. Rohit.
We also have Dr. Lakshmi Vedaprakash. She is from our Kondapur unit. So all the high-tech city area, the new parents, I'm sure, Dr. Lakshmi, a lot of questions will come to you also. So thank you so much for joining today.
Good morning. Good morning.
And we also have Dr. Satya Narayana. He is from our LB Nagar unit. And I'm sure, Dr. Satya, a lot of your patients from the Secunderabad side are, going to involve you a lot in the question answer session. So welcome to all three of you. And what we will do is that, we'll just pick up questions as they come up. But there are some questions that I already have picked up from a lot of parents who have been asking me. And I will start off with that, so at least the discussion will get started. So first question to you, Dr. Faisal. Very, basic question that pandemic, has been, we've seen a couple of waves, 1 and 2. Do you think it's the right time to start schools, or we should have waited?
Good morning, Dr. Rohit. Good morning, parents. Good morning, children. Hope you have a lovely Sunday morning. Dr. Rohit, in the last 1.5 years, the whole world has gone through lots of ups and downs. So my message to my patients and my children is always that fear never builds up the future. It's hope that does. We have to be very hopeful for the future. Our parents also have to make an environment of positive energy to be there at home, and to just ensure that the children would be ready when time comes. The course of COVID-19 pandemic remains far from unpredictable. So it's there are different waves going on at different parts of the world. There is a response each country is taking in a different way. The school reopening questions have not been resolved satisfactorily wherever the schools have opened up. But I do understand that with the government's directive coming in regarding opening of school and those things, there would be a certain thought process and directives for schools. How are they supposed to ensure safety of kids and those things, and that should be followed. We are here all to just let parents and children know that when the school reopens, what kind of precautions they are supposed to take. Okay, back to you, Dr. Rohit.
That's true. We're not the policymakers, but we will make sure that we do the right things to take care of our children. So, Dr. Lakshmi, see, we have had a lot of vaccination for adults. There is a lot of talk happening about vaccination for children. Still, it is not out as yet, right? So, two questions. One is, where are we on the vaccination side? Have you heard anything? And second, do you think it would have been wise to wait till the children's vaccination is over? What is your thought there?
Good morning, Dr. Rohit. Good morning, parents. Good morning, children. About the vaccinations, we have studied a couple of vaccines, and the results of the vaccination trials are almost completed, and they are going to start the children vaccination, but it is not confirmed from the government yet. But whether to wait till the vaccinations are completed, that is going to be that question is like, now that the government has decided to open the schools, the vaccinations for children, even though if they start also, they are going to start in a phased manner. So they're going to start the children, the vaccination for children from the 12 years onwards. 12 now, the 18 year plus are getting. So the next phase will be like from 12 to 18 years children, and the subsequent phase will be from 6 years to 12 years children. So it is going to take time. So the schools, the government has decided to open because the all over the world, the western countries, like who started vaccinating children also, like they started open the schools much before. Once the adult vaccinations are completed, they started opening the schools. So in our country also, we are going to follow the same. And the decision has been taken by the government, so we all have to be prepared for how to send our children in a safe environment. Though the vaccinations, yes, they are going to come when they are available, then all children will get vaccinated, but it will be in a phased manner.
Yeah, that's true. That's true. So, Dr. Satya, is there any rationale? Do you advise any other vaccinations that children can take in prep to go to school? Like a lot of people are talking about flu shots, etc. Is that advisable? What is your suggestion?
Yeah, the good morning, Rohit. Good morning, parents and children. Yeah, this is regarding the other vaccines in this pandemic scenario. The problem here is like this is the bad season for children. Like you get all seasonal diseases like swine flu, dengue, malaria, typhoid, so many seasonal diseases we come across in this season. So everybody is talking about the flu vaccine particularly because they don't have any COVID vaccine right now till the age of 18 years. Probably it may come in next 2 to 3 months. But as the flu vaccine is available, it can counter swine flu and a flu-related illness. Because now what we do is like if we get cold cough, we are confused with whether it is the flu or COVID or any other thing. So that confusion will come down by taking the flu vaccine. That is one aspect. And the other hypothetical, like if you give flu vaccine, it is going to prevent is not studies are available So don't be an impression that by giving flu, my child will be partially protected against corona. It is not correct, COVID. So take flu vaccine. It will definitely help in countering other infections. By that, we can be little better. Number of infections, cold cough will come down. So we don't have to screen everybody with cold cough for COVID. This is in this way it helps.
Dr. Faisal, any vaccines that you recommend, vaccine preventable diseases to handle them, just in the preparation for school?
See, we as adults and doctors also, when the epidemic had started in March 2020, we had taken the flu shots. Doctor community is all over the world ensured that take flu shots and try to build up the immune system and those things. See, Dr. Rohit, there is one thing: there are vaccination preventable diseases, okay, which can be prevented with vaccinations. With this current outbreak, what is going on and those things, we can't afford another outbreak of seasonal flu, swine flus, and those things hitting children.
Yeah.
So it's always better parents be up to date with their vaccination, okay, and especially flu shots are something which would enhance their immune system and those things to fight against seasonal flu viruses when schools are going to go on. WHO strongly recommends vaccination for children less than 9 years specifically. Okay, with in the near future we will be having the vaccination for COVID in children that is from 12 to 18 years of age. So I suggest my patients that 12 to 18 years of age, in the next coming few months, you will have your vaccinations for COVID. But less than 12 years of age, if they're planning to go to school and those things, flu vaccination should be a good option. That's my personal thought on that.
Yeah. Dr. Lakshmi, any view from your side? What have you been listening from your patients?
Exactly. Dr. Rohit, I agree with Dr. Faisal and Dr. Satya. The flu vaccine is not going to protect from corona. That clearly has to be explained for the parents. By taking flu vaccine is to prevent the seasonal flus. It will prevent the seasonal flus, but definitely it is very important to prevent the seasonal flus also, because that the clinical symptoms will cause the confusion and also outbreaks and all that. So what is available in this age group, the vaccination, flu vaccination, it has to be given. And also it is hypothetical that children are during the pandemic, the children have been affected very minimal, with minimal symptoms they started improving. The one of the reason is these antibodies to this common flus and all are protecting the children. That is the hypothesis why children had very mild symptoms throughout the pandemic. So that also puts the flu vaccination at on the positive side, parents may consider that, giving that to their children.
Okay,
before
that's
starting schools.
that's helpful, Dr. Lakshmi. So, Dr. Faisal, see, if you remember, we talked about the first wave, then it was the second wave. Then there was a huge, hue and cry about a third wave, and the hypothesis was that it will affect children more than adults. Right? It's not proven; it's a hypothesis. But do you think this, school opening will bring that to reality?
See, nobody knows about the future, Dr. Rohit. There are hypotheses and those things. Now, if you see after the first wave, post September, the first wave when we have in June, July of 2020, we had children. We have seen children getting less affected, definitely there. Now we have a population who had got exposed to COVID. Then we have a second wave. By the time of second wave started, we were still, the community was not vaccinated. The hardly less than 5% of people were vaccinated by that time. Now we have a lots of population who has taken vaccination. When they have taken vaccination and those things, it's understood that they're going to be prevented against serious illnesses of COVID and those things. Okay, it's the population which has not taken the vaccination for COVID. That is children who are less than 18 years who have not taken the vaccination. So there is a hypothesis that this may cause a problem. See, it all depends on how efficient is the school system with their vaccination, teaching and non-teaching. How efficient is the government guidelines? Like how do they want to segregate children? Whether they want to keep them in some kind of clusters, bubbles and those things. They want to run the school on a full strength. These are all things which the government has to take a decision, and the school authorities, how are they going to manage it? then only parents can get confident that how things can roll on further. And this confidence building measures happens gradually. It doesn't happen just all of a sudden. So these are few steps which they have to take, and they have to understand this image building kind of thing. And those things, once it happens, parents will feel a little bit confident about sending their children to school. Last time, if you see, the schools had started in phase wise. So we have not come across till now that we don't know whether they are going to do the same thing again, that it is going to start in phase wise, or they're just going to open it all through.
Yeah, yeah. So, Dr. Satya, there was a question from the audience saying that, it's felt that smaller children have not been affected by COVID, right? Less than 8 years. But you have now seen children across now 1.5 years. What is your experience across, COVID and the age groups of children, irrespective of school opening? Maybe we can just throw a little light on that.
Yeah, this is we have scientific reason for that also. Like if you see, like as Faisal said, the first wave and second wave. In the first wave, it is the older age group and with risk factors only got affected with this COVID. Second wave, almost even the younger generation, it has come down in the age. Like even 30 years, 20 years also, they got affected and severity was there and even they died also. That was the second wave. So now the assumptions and hypothesis that it can affect the lower age group, below 18 or below 22, even the smaller children. Coming to the question, like less than 6 or 8 years, there is nothing like that. They are immune to COVID, but we have scientific reason. Thing is, like it affects the lungs where you have AC receptors. They are very very minimal in younger generation, like young people, young kids. As the receptor is not there, that is the vehicle carrier, and its effects should be through that receptor. So if as that the number of AC receptors are very less in children in lungs, it can affect, but it is indirectly, you can say that number of infections may be less, but it is not that they are immune to. And another point I would like to stress here or emphasize here that the variant is changing. Once the variant changes, we don't know which receptor which is going to attack. So that we should be very careful and we stick to all the basic measures like physical distancing and other things. But don't go by the saying that less age children are protective or immune. It is not right. But only scientific reason is because of AC receptors. Their infections are less. Severity is also very less.
Yeah. So, Dr. Lakshmi, now when you say phased opening of schools, right? So, Dr. Satya talked about younger children having less receptors. So, the hypothesis that they'll be less affected. Now, 12 to 18, if you go that, don't they behave a little bit like adults? That they might have more, chances of contacting COVID. What is your view there?
Yeah, older children, 12 to 18 years, when they open the schools, yes, we had seen in the first wave and second wave also the children are getting affected, but most of the children are recovering with mild symptoms like a common upper respiratory illness type of symptoms. So very few children only are actually getting into the hospitals. Like whereas in adults, the percentage of hospital admissions and irrespective of the age group, like from 30 years on, also the adult population got sick and got hospitalized. But in the second wave, we have seen children from newborn babies to like till 16-18 years also, they had the they positive RT-PCR test, but the symptoms they had were very minimal. The hospitalizations were very less. In fact, those going on to the ventilator, and those are very, very, very few. So overall, the all over the world, the experience in the pediatric age group is during the pandemic, these population got affected with, and they are coming out with minimal symptoms. In UK, they started seeing this multi-system inflammatory condition post-COVID in children. When they started seeing the cluster of children coming up with this inflammatory condition, but the incidence of that also is less. And now that the number of cases of MISI all over the world also reportedly going down. In India, after the second wave, we started seeing very few children coming with this multi-system inflammatory condition. But the MISI incidence also is reported within the 8 to 12 weeks period from the positive
Yeah.
COVID RT-PCR test. So if we have taken the number of COVID cases, the peak has happened in our country in around the May month. So if we take the time frame from the May, now we have almost completed 12 weeks. The cases of MISI reported are very few.
Yeah.
So considering all this, whether the third wave is going to come in children, like obviously the third wave children will be the most affected because they are the majority, that's the majority population who hasn't had the vaccination. 18 years plus we have completed. I heard recently that in one day they have done 1 crore vaccination. So our country vaccination rate is going in a rapid phase. From 18 years plus we are vaccinating most of our population, but less than 18 years, yes, we have not vaccinated. But in that age group the symptoms were very less, and they are recovering in within 48 hours like any other common cold. But still the precautions have to be taken. The government has made this decision about opening the school because the experience from the other countries also is like that opening of the schools can be can be done. Because if we don't do that, the children are missing out on many other things, and we are going to have a pandemic of lifestyle disorders in future.
Yeah.
So we have to draw a line at certain stage and get the near normal stage as much as possible with all the safety precautions.
Yeah, that's true. So, Dr. Faisal, so let's say we say the schools are starting, then what is your, any precautions for the parents that you would recommend? Will their vaccination help? Do we need to do COVID testing? What is your thought there?
Dr. Rohit, we have gone through certain guidelines and those things, WHO as well as CDC. It says, first of all, parents, elders at home who are more than 18, all should get their vaccinations done. Okay, so how do you build up the whole situation whenever the school starts to open? We are not saying that it has to open up this particular day, but whenever you want to send your child, your child has to go out. There is no doubt about it, because we are seeing children, smaller children especially, with learning disabilities and problems because of too much indoor activities. Okay, so definitely elders should get vaccinations at home. The parents should get vaccination at home. People who are more than 18 years should get vaccinated at home. Teach your children how to wear a mask. Yes, social distancing, physical distancing in the school. The school also has to learn how things, social distancing can be practiced in the school. Okay, indoors definitely the use of mask would be helpful. Outdoors they can not necessarily to wear a mask. Okay, when the rooms, the school classrooms have to be well ventilated, so the windows can be open. They can use a mosquito mesh or something to avoid insects and those things coming in, but the rooms have to be well ventilated. Okay, teach your children about hand hygiene and those things, how to wash hands. That's important. Staying home is important. Testing children, there are some questions which I have seen from parents coming in, whether testing, how often testing. See, sometimes in some countries it has even been practiced about keeping children in a bubble, like particular group is there, one classroom, one group, they stay together. Okay, so one of them falls sick or something and not reported and those things, and if he has tested positive, then the whole class has to be tested. That is the way things were practiced in some countries and some schools. Okay, that is one thing. Cleaning and disinfection, we need to be very thorough, that our children have to be taught about how to use disinfections and those things. Some parents even ask the questions on the forum that about washrooms. So it's the responsibility of the school authorities wherever they're attending. Their washrooms have to be disinfected appropriately whenever children come back to school very frequently.
Yeah. So Dr. Satya, if you look at it, see, when the children go to school, um, if a child does fall sick, right, and is tested positive, so what happens? I mean, the whole class is quarantined. How do we manage that?
Yeah, it is a very practical and very important question. The thing is like extension of Faisal's discussion, like if you follow for social distancing, masking and good ventilation, hygiene, that is cleaning as well as disinfection of the classroom, toilets and everywhere in the school, then it can come down. But coming to the infection, this is the season. So every cold cough a child, we have to suspect the COVID. We have to suspect basically. So this, if how we can prevent, I'm coming to then come. I will come to your question. So any parent we have to inform. School authorities should inform that any child who is sick. It is not just the cold cough, because in the second wave we had so many with loose motions, vomiting, stomach pain, and just fever also. So they also had tested positive for COVID. So I would like to stress here that it is not just the cold cough. So all these symptoms, if any sick child, even with fever also, don't send them to the school. This is one basic thing. Yes, they have come to the school. In the school, they should do the screening. Maybe at the gate or entrance or classroom level, there should be personnel to check screen. If anybody is found to be having fever, they should send it back. Request the parents to take the child back. So this is second check. So you should have multi-level check to prevent, so that you don't have the positive child in the school. Now, coming to the positive child in the school, if any child is sick and he becomes positive later. So this maybe see, child was sick, he was there in the school or class for a day or two. Later on, he found to be, because you are not going to get it positive. You are not going to do the test. So if he becomes positive, they should inform the school authorities, and school authorities should find out what happened to that particular child. Was that COVID? Then screening should be done in the class, and based on screening in the class, teachers who attended, staff and any other member encountered or in close contact with that particular case should be screened. If they are symptomatic, immediate screening. If they are not symptomatic, usually on day 4 or 5 do the screening. If they are positive, all of them should be quarantined. This is ideal. And if teacher is there, other personnel who are more than 18 years, they are vaccinated, don't do any screening, not required. As long as they are symptomatic, testing is not required for other personnel other than the kids. So if they are not vaccinated, then they should be again screened like kids. Then if they are positive, it is better to quarantine. But for kids, irrespective of the screening, they should be quarantined for 14 days. And you have to twice doing the screening is always much better.
Yeah. So, Dr. Lakshmi, these, a lot of, we always know, I mean, kids in school, they congregate together, right? So we talk about, school buses, eating area, washrooms. So, how do we practice social distancing there? Is there anything that the schools can do differently to be able to manage this whole situation? Because class has 40 children, so how do you manage that? I mean, they're all going in buses together and they're pretty full. So I can't send my kids if the buses are not there. So what is your any suggestion for the school?
Yes, the children have gone through the pandemic, and actually they have gained a lot of knowledge from home also, like over last 1.5 year. Like if you ask the secondary school children, like 7+ classes, they know very well, like what is social distance and mask, and about this pandemic they have gained the knowledge. The children are ready to cooperate. Like I started putting these questions to children, like if they school already open, like what. So I feel they are ready to take, and like we can educate them and the school preparedness, and at the same time from the parents also they have to cooperate. Like in the school buses, maintaining the social distance is very difficult. In school, some innovative methods, like seating arrangements can be changed. One child can face this side and the other child, like they can make changes in the seating arrangements, and good ventilation should be ensured. Then actually, the studies have shown that mask, wearing the proper mask, will help more if we don't have the, yes, social distance has to be maintained, but if we have problem with the social distancing in those areas, like if the mask is or properly by both sides, everyone, like the person, everyone should be wearing the mask indoors, proper fitting masks, that will prevent aerosols and droplets both. uh, that should be ensured. And they have to come up with some strategies of calling children in two halves. Maybe if they have a class of 40, few children attend Monday, the Wednesday, Saturday, like that. They can divide and make them attend to maintain the social distance. Um, the school buses and all that, like we have to maybe arrange the transport. Then even in the buses also, we should teach the children to wear the mask and shield properly and maintain a good hand hygiene. My hand hygiene is very important. They really, they have to wash their hands thoroughly, sanitizer. They should, every child will have their own kit.
Yeah,
That preparedness is important.
it's important. Yeah.
About the social distancing in the schools, it is difficult, but first thing is ensuring the vaccinations of everyone, like the adults who are coming in contact with these children in the schools. If their vaccinations are all completed and proper screening at the level of entrance itself, that has to be started from at house. Like if your child has any symptoms, don't send them. And then screening and checkups, the checkpoints at multiple levels, starting from home, when they're entering in the bus, when they're they're entering into the school main entrance, and then main classroom, like multiple levels checkpoints,
Yeah.
and then how to segregate them. So if all these precautions are taken properly, then we can try as best as possible.
Yeah. So, Dr. Faisal, one question for you. So, amongst all of us, you have specifically managed a lot of COVID positive children, whatever came, in Rainbow. I can confidently say you were the one who were involved in all of that. So, two questions for you. So, number one is that what is your view that risk benefit? See, someone asked, oh, do we have school going children? I do, and I'm very keen to send my children to school because they're having mental problems, they are addicted to computers, they're getting obese. So I do want them to go to school and study. So that's the question. I'm sure all three of you would agree with to me on that. But what is the risk benefit? Number one. Number two, children. And how do we make sure they wear masks? Can they do sports in school? Is there anything else, just to make sure that it doesn't spread? I mean, you know it very well. So, what is your view there from the experience?
See, thanks, Dr. Rohit, for asking that question. Yes, we did manage lots of COVID patients, but not few children. It were more adults and pregnant women. Okay, so there was a crisis, and where the hospital had to chip in and start up a center. And yes, we had a learning experience there that time, that children had generally fallen sick less.
Yes.
And the symptoms what they had were especially children who had comorbid conditions also, like children who had some problems, other problems, and those things. Generally with COVID, they have not become very sick. more than a doctor, I would say this to all my viewers right now, including parents and children. I am a father too. I have children. Okay, with my experience with COVID and those things, yes, definitely. Uh, my children who are more than 12 years old, I would prefer them at this stage with due precautions and education. Being a responsible parent, I may send them to school because their lifestyle changes has affected them a lot. Okay, more of online training and those things. They need some physical activity, definitely. Okay, children less than 12 years, we are hopeful that we have vaccination for them in the near future, and then it becomes more beneficial for them. But more children more than 12 years, they will be able to understand what are mask etiquettes and those things, hand washing, hygiene and those things, social distancing and those things. It's very easy for that age group to understand it. Children less than 12, it may take a little bit of time, and more training and those things would be required for them. But believe me that we have not seen very serious and sick cases in children. Majority of us all over the country, I can say all over the world also, regarding active COVID infection in children less than 12 years. Okay, so once we have a vaccination and those things, things will be more positive. Definitely, it's there in the near future. It is going to be it is going to come for children more than 12 years of age. And there has to be some phased manner of opening of schools. I do agree with most of the parents. In the comment box, I have seen lots of messages coming here that how do we open up and those things. Can they open full strength or not? I am not sure about it. I am not here to give guidelines to the government, but I'm here to help my patients and my children and those things to just get mentally prepared. Once schools open up, how do you open up? In the where we have specifically seen children, if you say that children who were nearly about 1 year 15 months old when the pandemic started, that was March 2020, and they went under lockdown and those things. This year we are seeing those children with hyperactive disorders. They were more at home, they were more hooked up to TVs, YouTubes and those things, and we are seeing learning disabilities in those children more. There are children who had some language skills before the pandemic. Now they have having language difficulties and those difficulty in communicating in those, because always one-way traffic hooking up to uh, the screen always may not be beneficial for your child.
Yeah.
Yeah, back to you, Doctor.
Yeah. So, Dr. Satya, see, all children, we always say that schools are also the cradle of infection sometimes, right? So, children are strong, they manage. But will they bring these infections home? Does it pose bigger risk for our elderly at the home? Is there any precautions we should take to manage that?
Yeah, it is definitely possible because it is the school is one of the crowded area. Like unless you maintain physical distancing, mask and every other thing, still you have the possibility of getting infection home. So presently, I would like to stress on few points. Like recent today only, I read in the paper almost 67% of the population they have antibodies. These antibodies are secondary to either infection, that is because of the infection they are there, or because of vaccination. So most of them they are partially protected, I can say, because we are into like almost more than a year, 1.5 year to entered second year. Most of the people, elderly people, they got vaccinated, particularly at home. So I don't think people are there where still vaccination is to be given to elderly people, maybe parents or grandparents. So bringing infection is possible, but the same infection getting infected to the family members or giving infection to the family members, I think it is a little less. So don't worry about those things right now. Unless again, if any other different variant is there, which is not, I mean, the antibody is not protective to that particular variant, that is remote possibility. So as of now, with our knowledge, we can say that yes, you can bring home infection, possible definitely because it is the crowded place from the school, but the family members getting infection right now because it's not the first and second wave, we have crossed that and into in the second wave, so it is little less possibility.
Yeah, I think that's fair. So it's
Yeah.
very, and as Dr. Faisal said, I think we have to make sure that everyone in the family should be vaccinated.
Yes.
But that does not mean that if someone who's not vaccinated, the second dose, they should not send children to school. That's a separate, discussion altogether. So, Dr. Lakshmi, see, we talked about masks. We as doctors have wear masks 12 to 14 hours a day, right? But can children wear masks for long time, 6 to 8 hours? Is that safe?
Dr. Rohit, they can wear the cloth masks. It is cloth masks are safe. They can wear. Can they wear for long hours? Yes, they can wear for 6 hours. But the experience we have with this condition is of recently we have not had children started going to school since the pandemic has started. This is what we have seen from all over the world. When the children started going to the cloth masks are recommended for children in the indoors, so the classrooms they have to wear, and it is safe to wear. They can wear it properly if we train them. It will be an issue. There are certain skin conditions, like if the child is allergic and they have the rashes, anything, eczema, anything like that, they can be offered the face shields. So those children who are allergic and to any skin diseases, anything like that, they can be offered the face shields also. But combination, the social distancing with face coverings are must. A kind of face covering, either the mask or a face shield.
Yeah. So, Dr. Faisal, people have a lot of misconceptions about masks, right? They feel that you have to always wear N95. Can you just spend just a minute to just remove what are the best masks for children? Is N95 needed, or cloth masks are okay?
No, N95 is not needed in children when they don't come in contact with some direct kind of procedures what medical professional and those people are exposed to. They don't work if they are maintaining social distancing and those things good enough. They're not going to crowded places, too crowded, overpacked rooms and those things. Yes, a simple, as Dr. Lakshmi said, a simple layered mask, cotton mask is also fine for them, which has to be changed and washed after every 8 hours. Face shield will give them extra protection. That's good. Okay. Recommendations all over the world is right now, masks are supposed to wear indoors, outdoors where it's not required. Like suppose if they're a playground where social distancing is good enough, it's good ventilated in those areas, they can just pull down their mask. So it's not a continuous process what they need to do.
Yeah, that's true. So that's good. There are a lot of questions on that and a lot of misconceptions floating around. So we have learned over the last 1.5 years what works and what does not. Dr. Faisal, the children, so I think the parents are very worried. But one thing is that what is the prep mentally do we do for children? Right? They have been indoors for 1.5 years, especially my kids. So now they are a little more worried about not about the COVID itself, but just going back to class.
See, for a child, his or her heroes are his parents always. So he doesn't look forward to anyone else in this whole world except his parents. So his parents have to be mentally very strong.
Yeah,
they have to be strong. They are all his support. For a child, his whole support is his family. So family has to be very positive. I'm not saying that positive means only on this front. It has to be each and every front. Okay, so you cannot be demotivated and those things stressful, because we had seen lots of children who had come with psychological problems, negativism and those things post second wave, when they were getting lots of negative news and those things, especially whenever the phone used to ring, everyone was worried that once one relative of them is sick, they have lost some relative and those things. So that kind of negative news and those things had put altogether a different impact on children. So it's very important that we practice hope at home. You need to be quite hopeful. You need to ensure your children, give them this is a phase which will go away definitely. Okay, we need to be mentally prepared that okay, once things may open up, the opening up is going to be a big problem. It's not that easy. We can't just do a 1 hour session and say that everything is going to be all right. No, it's not going to happen. See, practically, you, me, as parents, also we have to practice many things. I, as a pediatrician, I will be faced with many questions and many problems later on also. When how does things unfold when the schools open up? Because it's a structured approach how schools open up, and how do we react to schools. Children or parents who are belittling that, okay, my child has cough and cold symptoms and he is kept at home, there has to be a flexibility from the school side also, that the online teaching has to continue. He may not be necessarily positive, COVID positive. He may just have some different flu virus or those things, but till the test reports come, he might be negative even. But there has to be a flexibility that he doesn't lose out. That that problems in our community is going to be a major challenge. That once we start offline, online will be stopped. I don't think so that should happen. It's a simultaneous process which might go on till we have a clear cut picture in the coming months.
Yeah, that's true. But so I'll just take one more. It's an argument and a discussion. There's no right answer. But Dr. Satya, now in the last 1.5 years that children have been at home, uh, apart from COVID or any physical issues, what kind of issues have you been facing in children because of the fact that not going to school and having that physical interaction with peers? Mentally, what kind of behavioral changes are you seeing, just to see whether it's worth it at this point in time?
Yeah, we have seen. See, for the last 1.5 year, I can say when they are with online classes only, we had complaints from the parents, physical as well as mental also. Physical complaint, particularly they are at home, so probably eating little more. It is possible even with us also. If I am at home watching cricket, I can eat little more like that. So they are addicted to, habituated to eating more, maybe junk food, whatever. So they are gaining weight. Almost I can say more than 90% there is a weight gain, and few people they are falling into this obesity category. That is one physical problem. And mental problem is like this you can divide into different age groups. If you see the adolescent age group, they are getting addicted to YouTubes and different kinds of screen times, maybe mobile, laptop, or whatever. So they are addicted to. So that is one. And if you come down to the lesser age group, so they are also getting addicted to. And the people, example, I'll tell you one more. Recently, what we see in the OPD, sir, my child is not talking, and his the speech initially he was a little better. Now he's not talking those few words also. Yes, it is possible because interaction is very minimal. They are not playing with the kids, even with the neighbors and in the apartments and colonies everywhere. So interaction has come down. No socializing. So because of this younger age group, there is a speech delay. I can say we can have one paper on that. I mean, we can talk to the parents. We can discuss about almost 1,000 kids, and we can see significant percentage of kids around less than 5 years. There is delay in speech, and there is non-progression of the speech. You can say this is one more mental and other problems also we have seen. So what I would suggest here is like so many questions I am saying in this message, like the risk benefit ratio. As a parent, yes, as a parent now, I can say I don't want to send my child to the school. Yes, you are right. But in person learning and learning in the school definitely it differs. And the second question is this the right time to send my child to the school? Yes, you are 100% right. That means this is not the right time, I can say, but we are not the right authority to say. This is the government decision and they have decided. It is up to you whether sent to the school or not. If sick, don't send. And if you want to wait for some time, this is my personal suggestion. Wait for 15 days to 1 month. What is going to happen? Send it little late. Just observe what is going to happen. Is the third wave is going to come or not? Yes, you can wait. Then again, authorities will decide whether to continue or phase wise they have to come back. So that will be decided in near future. So this is my advice. So thing is like you have definitely risk. It is going to increase. Probably few parents may say we have waited for almost 1.5 years. We'll wait for 2-3 months more. Yes, you are right. But again, there should be a time where we have to take one step further. So I think it is the step one. So we have to think and decide. This is up to you parents.
Yeah. So, Dr. Faisal, let's say I as a parent decide to send my child to school. So any advice for me, prep for me to make sure that I can keep my child safe as much as is possible in my control.
See, most important thing, doctors do come to the doctors whenever we are medical students and those things, and going to the hospital. Our head of departments used to say us, never come to the hospital empty stomach. Empty stomach will keep your immune system always a little bit low. So have a somewhat decent breakfast and then come to school. Don't let your children go empty stomach to schools. Ensure they wake up early before their bus or transport arrives, and they have some kind of breakfast and then go to school. So have a healthy, balanced diet. That's important. Avoid junk foods. That should be more helpful. Okay, start training your children about hand washing etiquettes regarding how to use a washroom, how to use a hand sanitizer, how to do hand washing. Those things should be helpful for children. Okay, social distancing and those things should be practiced. That should be helpful again.
Yeah, that's great. So basically, what you're saying is that these are some tips that we can do to make sure that our children are safe, right? So, Dr. Lakshmi, what is your view on that? I mean, a lot of you are right at the belt, at the high tech city belt. So many kids come to you. Any advice on kind of diet they can use? People have been asking me about immuno boosting diet or supplements. Anything required, or regular food is enough? What is your view?
Regular healthy diet is enough. Immuno boosting, there is no special immuno boosting, immuno boosters, medication, supplements. All these are like only for the advertisement purposes. So these immuno boosters are they're nothing like immuno boosters. So balanced diet and these precautions have to be taught. What are the safety precautions? Hand washing and social distance and wearing a mask appropriately. These three should be taught, and regular balanced diet should be enough. When it is coming to the hand washing, it is better if parents teach all children the 20 seconds hand washing technique. Like they ensure the in between the fingers and then the fingertips. Okay, like both sides hand washing. These should be taught to the children. And when they're putting the sanitizer also, teach your children that to put the sanitizer especially in between these fingers and the fingertips, because those are the places where the germs can go most, and that's it. And if we don't cover those areas and not washing hands properly, again there is a risk of transmission. So these kind of things should be taught to the children. And wearing the mask appropriately, like indoors is very important. Outside, like all throughout 6 hours, 8 hours, they get a break in between the class sessions, where like they can go and get some fresh air and come back and sit. And you know it's been like, if they go to school, it's after so many after years they are seeing their children and their friends. So going, hugging, and playing games, shaking hands, this is the new normal life. So this should be taught to the children. This is how we have to do till the situation gets more better. Like maybe after, see, there will be one day, like where we have to start this ultimately, as Dr. Satyanarayana has said. And I am also seeing the messages in the chat box also. Who will be responsible if children get COVID? Who will be responsible? Is the government responsible, or hospital, or who will be responsible if child gets? See, this is yeah. Understand the anxiety from many parents. As a parent myself, I have a child who is in the sixth class. Uh, a sixth class kid, he himself have lot of he has that anxiety. I first instance he said, no, I don't want to go to school because of the COVID. Like when I'm panicked, I don't want to go to school. Online classes are better, online classes are safe. And this is there in the parents mind also. Many parents, online classes are safe. But this is 2 years of academic sessions, two academic years. They are doing the online classes, but definitely they are missing a lot. And their childhood obesity has increased. and a lot of behavioral problems in children we are seeing. They're not expressing it out, but they are coming out just to come in to the hospital as, like, complaining of tummy pains, nail biting, repeated blinking. It's a lot of behavioral problems we are seeing in children. And academics wise, yes, classroom no way equivalent to the classroom teaching. These online classes are no way equivalent to the classroom teaching. uh, the children potential is not coming out. They're doing some teaching and some exams, some completing the questionnaires and all, but what about those skills like leadership qualities, or those elocutions which happen, physical fitness, like sports and all. But 2 years is a really big time in a child's career, the academic career. So maybe,
Yeah.
yeah. Again, parents' anxiety, I can understand. If it's going to come, the vaccine is going to come, and it's in very soon, like, maybe 2 months down the line, it's going to complete. Then why unnecessarily start sending the children to school now without vaccination? That I understand the parents' perspective as well. But ultimately, it is the parents' decision only. uh, we have to see the pros and cons, and we have to see how best we can send our children. Safety, teach your children all the what are the prerequisites. Every child should have a separate water bottle, separate sanitizers, bag, face shield, all this. Because in schools they cannot have they don't be any water fountains or anything. So child should carry their own food, water, everything. And during the eating times also, they should be maintaining the social distance. Wearing the mask is important, but there can be relaxation, like when they go outside and they maintain social distance, they can remove the mask for some time. Hand washing, teach all children the proper hand washing technique.
Yeah. That's correct. So I think, as you rightly said, Dr. Lakshmi, everyone is anxious. We are doctors here, so we are not. We neither promote opening of schools nor we say no to it. We just want to make sure that children are safe. We have kept them safe through over the last 2 years, and all of you have contributed very hard towards it. And that's what we'll keep doing. So wherever we have an opportunity to tell the government, we will give pros and cons. But as you rightly said, Dr. Lakshmi, there are pros, there are cons too. We all of us have kids at different age groups, and that's what the contributes to anxiety. So I think we answered predominantly a lot of questions that came up. So let's summarize. So I just want to hear from each one of you. Some one couple of lines of summary, the message that you can pass to every one of our audience. So Dr. Faisal, what are the couple of messages that you would like to leave with everyone?
Be hopeful, be positive, stay healthy. Okay, things would certainly open up. Not now, maybe later on, maybe some months later on down the line, maybe 6 months, 1 year later on. But we need to mentally prepare our children that okay, whenever it starts opening up, it has to open up this way. Okay, and we need to do this exercise to make them mentally ready. Okay.
Yeah. I think it's a lot about mental readiness. You're right, Dr. Faisal. So, Dr. Satya, any last closing comments from your side? Summary.
Yeah, this is like a few points I would like to stress here. One is the to counter COVID-19, third pandemic, as well as the schools. One is good nutrition, good sleep, also very important, as well as physical activity to improve the immunity. And the second point, physical distancing, masking, other things you should do wherever you are, except outdoors, unless you are vaccinated. And third thing is, I like to advise even the teachers in schools also not to stress the children because they were out of your school for almost 1.5 2 years. Particularly children less than 12 years, they are just getting adjusted to come to your school. If they are there, don't be, giving little more homework or academics. As a parent, I am advising you here. So there will be little more panic, and we as doctors see little more behavior problems compared to pandemic. So this is my suggestion to school administration and school lecturers or teachers. And stay safe, stay, I mean, get vaccinated as early as possible if the vaccine is available.
Yeah.
Thank you.
Thanks, Dr. Satya. Dr. Lakshmi, any last comments from you, summary?
Yes, Dr. Rohit, and vaccinations of everyone should be ensured. Like all those who are eligible for vaccinations should get vaccinated on priority basis. We still are seeing some adults who are eligible but still haven't taken the vaccine because of so many myths and misconceptions. So those pregnant women can get vaccinated, and those lactating women mothers also can get vaccinated. So in this group also, parents, like, if the mother is lactating, probably ensure before you send your toddler or child to the school, adults should get vaccinated first, because they can carry the virus, and those are not vaccinated adults, and those vulnerable population, like 60 plus, who have comorbidities at home, grandparents, those will be at risk. So ensure vaccination of all those who are eligible for vaccination.
Great. So I think, very well said, all three of you. Let's just, as adults, make sure that everyone is vaccinated. Rainbow has been helping in vaccination of all adults across all our hospitals. We have been open all 365 days through the pandemic. We're still open. Any problem, please, we're always there to help. We just want to make sure that the children are safe, they're healthy, and they have. We always weigh the pros and cons, benefits, and the risks of going to school or staying at home. But we as doctors just want to say that we are with you. Rainbow is with you, and we will be there, whatever decision is taken, to keep our children healthy. Thank you so much, panelists, for spending time today with us. And just for benefit of everyone, the video recording will be available on YouTube, Facebook. You can have a look, respond to any one of us. We'll make sure we'll respond. We'll get back to you. And whatever the decision of the government is, we're not influencing, but we're there to help, support all the parents as well as our children. Thank you so much, and have a great day, great Sunday. Thank you, panelists. Bye.
Thank you. Thank you. Thank you.